I think it is 7:30. We will start. Welcome, everyone. I'm Lendon, for those who maybe this is their first time. Welcome to Dressage for Kids UP program, UP standing for Unmounted Programs. A huge thank you to Carol Baker and Susan Sieber and Mary Livernoir who do the organizing, all of this. I get to just come on and chat. I have no other responsibilities as this goes. Also, we want to thank the Connecticut Dressage Association and Trafalgar Square Books for their sponsorship. And speaking of Trafalgar, at the end of the talk tonight, we will be doing a drawing. Mary has a list of everyone who's on the Zoom call at this during the evening, and we'll have a drawing for one gift certificate for Trafalgar Square. We're blessed that they have been a sponsor, I think, for all of our 25 years. This is our 25th anniversary. Makes me feel very, very old. We are recording these, and most of our sessions are recorded and can be found on our YouTube channel. We try to get them up as promptly as we can after the talks. Also tonight, if you have questions, if you can put them in the chat, we will, possibly I'll interrupt, but more likely at the end, we will see if we can have time for some questions. So we're very pleased tonight to have Dr. Bubulka, I hope I'm pronouncing that correctly, who's originally from Chicago, Illinois, where her love of animals was obvious. She began riding lessons when she was 6 and was soon spending all her free time at the stable. She attended Augustana College, earning her bachelor's degree in biology, and then went on to get her DVM from the University of Illinois School of Veterinary Medicine in 2020. Throughout veterinary school, she realized her passion for equine sports medicine. She's excited to work with Grand Prix Equine, which is located in Western Connecticut. I believe they work through Connecticut and probably Westchester, New York, as an associate veterinarian to continue to develop her veterinary skills. In her free time, she enjoys running, playing ultimate frisbee, whoopee, and baking, someone to get to know, for friends and family, as well as riding when she can. I also, before I let her start, I wanted to mention that our next session is Monday, March 11th, where Ann Guptill will be talking about the pyramid of training. You can find all of our activities. We have a lot going on this winter in person here in Wellington, Florida, as well as our Zoom sessions, and they can all be found on the dressage4kids.org website. So I will now turn it over to Dr. Bubulka.
Thank you. Thanks for having me, everyone. Let me pull up my PowerPoint and share my screen. Can everyone see? Visible?
Yes, looks good.
Perfect. So as you said, my name is Dr. Cleo Bubulka. I grew up around Chicago and then got my degree at University of Illinois. I then went on to an ambulatory internship at Grand Prairie Equine, which is where I'm still at as an associate. We're based out of Newtown, Connecticut, and I spend my winters down here in Wellington for the Winter Equestrian Festival. You know, my experience as an intern, a solo intern in an ambulatory practice, really introduced me to working up basic emergency cases in an ambulatory setting and creating, you know, great relationships with clients to get the best outcome possible for these on-farm emergency management. Oh no, oh gosh, sorry. 1 second. I don't know how to control this. Sorry, 1 second. Oh, I get out this. My apologies. 1 second. I don't know why controlling a slide deck is difficult.
It looks good here.
Thank you. It skipped a bunch of slides quite quickly.
Oh, I
so
see. Yeah.
I apologize. Okay, here we are.
Yeah.
So I wanted to start by discussing more of our normal equine vitals, as in order to recognize abnormal, we need to know, not only the equine vitals that are universally accepted throughout veterinary medicine, but our own individual horses, quote unquote, normal vitals. To start very simply, I'm sure you've witnessed your veterinarians before physical exams. One of the first questions I always ask my clients is their horse's temperature. The most common and accurate way to take a temperature in a horse is rectally. So I'll mention a couple of times throughout this presentation the safety implements that we use when taking rectal temperatures. It's important to note that most animals besides humans have a quite wide range of a normal temperature, anywhere from 98 degrees Fahrenheit to 1015 on the slightly higher end. Horses, especially the ones that we tend to work on in Connecticut and Wellington, are really high performing athletes, and surprisingly their heart rates can be quite low. Heart rate is a great way to determine pain in a horse, not only excitability. So it's important to take an accurate heart rate. Because of its slow rate, I tend to encourage my clients to take heart rates for at least 20 to 30 seconds and then multiplying that by 2 to 3, depending on how long we count for. Heart rates in horses are also a bit trickier to take because of the location of the heart. You'll see on that image that red heart really indicates the anatomical position of the horse's heart. And so when using a stethoscope, you actually need to go underneath their shoulder area to hear the heart. And again, that slow rate can make it quite difficult as well, which is again why I encourage longer times to count the beats. The respiratory rate in our horses is also rather slow and can signify pain, difficulty breathing, as well as excitability. It can be also difficult to count due to its slow rate. And so I encourage people to put their horse in a quiet area and count the breaths based on the rib cage moving in and out. As we know, in horses, they're quite prone to GI upset. And so gut sounds is another thing we look at when doing our basic physical exam in horses. The 2 stars represent 2 of the 4 quadrants, 2 on each side, that we listen to carefully with a stethoscope. You should hear 2 to 4 noises per quadrant per 2 minutes. Because of the slow rate, I encourage people to listen to each quadrant for 30 seconds to a minute, if not the full 2 minutes. Beyond this typical TPR and gut sounds in a horse, we also want to monitor our horses during normals of their manure amount and quality. That's the number of piles they produce in a given amount of time. I typically try to break that between 12 to 24 hours. The size of their fecal balls and the texture. Some horses routinely have drier fecal balls than others, and so to know their normals is to know when they might be abnormal. That goes with appetite as well. We all have that horse that prefers their hay to their grain, strangely enough, and so maybe it's normal for them not to finish all their grain, but if they have half a flake of hay, that's quite abnormal. I like to monitor water hydration throughout the day. That's monitoring how much water they drink throughout the day and night, normally by buckets. And the other way to monitor hydration is through their mucous membranes or their gums. They should be nice and slippery and shiny rather than what we call tacky or dry. It's important to know your horses at your farm or those that you own, what medications they're currently on. There are plenty of medications given on a regular basis that we need to know as veterinarians should an emergency come up. I don't recommend giving any medications or home remedies, especially in emergency situations, without consulting a veterinarian, especially if your horse is on other medications or have compromised body systems. So the common emergencies we'll talk about today are colics, which I'm sure most have been unfortunate enough to experience, wounds and lacerations, acute lameness, eye emergencies, allergies, fevers, and we'll talk a little bit about neurologic cases as well. So colic is a generalized word for abdominal pain or discomfort. It's technically not isolated to the GI tract, but because of the horse anatomy, it most commonly involves the GI tract. These are the common symptoms of colic, which is why it's so important to know your personal horse's normals. The very most mild cases of colic might be slight inappetence. Then we see things like pawing, rolling, or laying down repetitively, flank or side watching, along with generalized lethargy, diarrhea, things like that. And the type of colics we often see in horses can be as simple as impactions or gas colics. I also call those dysbioses, displacements that can turn into torsions or gastritis. There's a multitude of other types of colics, but those are a few of the most common, some requiring medical management and some requiring surgical intervention. Neither of these can be truly diagnosed without a veterinarian's exam at the very minimum. Choke is an emergency that we often see in horses that's related to colics. I relate them because of their involvement in the GI tract. A choke in a horse is not typically involving the primary airway like the trachea. It actually involves the esophagus, where a bolus of food gets stuck within the esophagus, causing hypersalivation, nasal discharge, coughing, retching, and difficulty swallowing. So both colics and chokes have similar management. These are common suggestions you'll hear from your veterinarian and some of the professionals around you. The first thing I always recommend to people when they call me with a potential choke or colic is to remove all your sources of food, any hay, grain, treats, even grass. In cases of choke, you absolutely want to give no food or medications orally until the choke is resolved. It used to be said that you want to get the horse to eat a small amount to quote unquote get things moving. However, until an impaction is ruled out, I don't recommend any food orally. I always remind people in any case of emergency, but especially in a choke or colic, that horses can be quite unpredictable when they're panicked or in pain, especially a choke. A horse that would otherwise be very sweet and let you, caress its head might be whipping its head violently and can cause quite a bit of damage. The next step that I typically have people do is keep the horse in a safe environment where they can be monitored. This typically is an isolated area so that you can monitor things like fecal output, water intake, etc. In cases of choke, I try to keep them in a quiet area of the back barn because they're already panicked. And the more they can relax, lower their head, the more likely they're able to resolve the choke without intervention. It's occasional that the colic is recommended to hand walk. And I always emphasize that hand walking might be useful, but there's no need to exhaust the horse by walking them for extended periods of time. The next emergencies we'll talk about briefly are wounds or lacerations. We all have horses that have minor cuts and scrapes, but there's the big question of when veterinary intervention is required immediately. The most obvious would be uncontrolled bleeding. We look at frank blood. We look at anything that's, for lack of a better word, squirting, flowing, or streaming, things that cannot be, where the bleeding cannot be controlled quickly and easily. The other wounds we worry about are any wounds near synovial structures and joints. That includes, the front of your fetlocks, anything penetrating up the bottom of the hoof. There are also tendon sheaths towards the back of the fetlocks that we are concerned about commonly. Any wounds associated with significant lameness should be one that is contacted for the veterinary, should have a veterinarian contacted due to the possibility of trauma to other important structures other than the skin and subcutaneous tissues. Any penetrating foreign bodies should also be examined by a veterinarian, especially nails protruding through the bottom of the hoof. In wounds and lacerations, the common suggestions you'll often find is, again, to keep the horse as calm as you can, remembering again that if the horse is in a dangerous situation or is uncharacteristically dangerous, to avoid putting yourself in a dangerous situation and to wait for professional help. You'll often hear the saying, dilution is the solution to pollution. And what we mean by that is flushing out wounds that are contaminated can decrease bacterial load. Before doing that, I would recommend contacting your veterinarian to ensure that the wound would not be further contaminated by unsterile water, such as that from a garden hose. I often recommend people to cover the wounds with a sterile gauze and a pressure bandage, if possible, until the veterinarian can arrive to treat the wound properly. I also recommend that you take pictures of all wounds. It's extremely helpful to the veterinarian on call to see the laceration, to understand its severity, any specific supplies that might be needed, or that if it's needing to be referred. I always tell my clients to avoid applying any store-bought or homeopathic ointments to wounds. A lot of these products, even the over-the-counter products commonly used, can be quite caustic or irritating to new, fresh wounds. They can also complicate any closure should they be too difficult to remove from the wound prior to sutures or staples. It's also important to never pull out any foreign bodies, whether they be in the hoof or a penetrating wound to the body or leg. Pulling out these types of things can cause excessive tissue damage, where surgical removal can avoid that. It also complicates diagnostics. As you see in the picture below, that nail kind of goes in potentially into a synovial structure in the coffin joint, and without the nail being radiopaque, it would be almost impossible to truly diagnose the damage done by that nail. The next thing we'll talk about is acute lameness. Hoof abscesses are the most common of all acute lamenesses, in my opinion. It creates a severe non-weight bearing lameness, but it can also create quite mild lamenesses as well. Hind hoof abscesses for me are notorious for looking like suspensories or other injuries that are ongoing. So it's important not to panic in those sorts of situations. The next most common thing that I see is cellulitis, which is just a subcutaneous infection. Horses are very inflammatory, and so when something like this happens, they have diffuse edema throughout their typically distal limbs. They're very painful to palpation, and they're often accompanied by a fever due to their infectious nature. Fractures also create an acute lameness, and they are often associated with histories of trauma. However, it's important to remember that we don't watch our horses 24/7 and that anything could happen. So it's best if you have non-weight bearing lameness or lameness at the walk to consult your veterinarian. Joint infections are often associated with a wound of some sort near the joint. However, in things like foals and young horses, they can also get septic arthritis without a wound. Laminitis is an inflammation of the lamina in the hoof, and it's most commonly affected the front feet, and the horses will walk on eggshells, typically. Common suggestions that I give when one of my clients has a horse that's acutely lame is to restrict the horse to a stall or confined space as soon as possible. Horses are animals of prey, and so when they are uncomfortable, they tend to, or they can run around more, injuring themselves more. It's best to keep them as calm as possible. I often tell clients to offer them as much hay or feed as they want for that moment, as well as bringing in a friend if they're normally out in paddocks. Many veterinarians may recommend NSAIDs prior to being seen, but I would always talk to your veterinarian about what NSAIDs might be best for your particular horse, especially if they're already taking other medications that might affect organs like their kidneys. If the horse is able to walk, I often recommend taking a short video so the veterinarian is able to see which limb is affected or how many limbs are affected. The next emergencies we'll talk about is eyes. Eyes can have a multitude of different emergencies, but their clinical signs can look very similar. So we can have anything from just swollen eyelids to excessive tearing, squinting, asymmetry of the eyes, meaning one looks like it's sticking out more than the other, or cloudiness of the cornea, which is the outermost layer of the eye. All eye injuries should be treated as emergencies, as once infection sets in, they can be incredibly difficult to treat, and they tend to progress quite quickly from initial injury to irreversible damage. In this eye particular, that horse actually was quite comfortable. However, the owners had noticed some cloudiness in his eye. In the bottom picture, you can see that bright green uptake is a large corneal abrasion. We were able to treat that horse successfully because of the early intervention. Another emergency that we see is allergies. Although the hives look quite dramatic in most horse cases, they actually don't tend to affect the horse as much as we would be affected. The emergencies come in when the horse's head and nose are affected, as it's very easy for them to get to have their airway compromised. In this picture in the top right-hand corner is actually a tracheostomy, an emergency tracheostomy that had to be performed on a pony who had gotten bit by a bug she was allergic to. I often recommend decontamination baths with something very simple like baby soap or an oatmeal bath while the horse is waiting to be seen by a veterinarian. Fevers are a common thing that we see in horses. It normally starts with a different clinical sign, such as inappetence or lethargy. Again, why it's important that you know your horse is normal. Obviously, just as in us, fevers are often infectious in nature. And so it's important to remember the horse's travel history and vaccination history when working up a fever. Fevers can be multifactorial in their both clinical signs and sequelae. So it's important to monitor them for diarrhea, lameness, coughing, sneezing, nasal ocular discharge to help your veterinarian diagnose the cause of the fever as well as the appropriate treatment. Because of its infectious nature, biosecurity measures should be taken as soon as the horse is suspected to have a fever. I recommend all my clients to keep all of their animals as in an isolated region of the barn, whether that's the back stalls or the back barn, or even sometimes an isolated paddock outside. I always recommend that we don't share equipment that includes not only tack, but hoses, buckets, feeding equipment, etc. I recommend that all of those activities are done at the end of the day after touching other horses in the facility are done. To diagnose a fever, of course, you'd have to take your horse's temperature, and rectal temperatures are the most accurate. So I recommend desensitizing your horse to rectal temperature taking prior to an emergency. That includes something as simple as touching their tail and lifting their tail, and then eventually using a thermometer on a regular basis with them. The last topic we'll talk about as far as emergencies is neurologic emergencies. That can be as simple as a horse with a drunken walk, that's what we call ataxia or lack of coordination, to something as scary as a seizure. All acute neurologic events should be considered an emergency and have a phone call to your veterinarian. Again, this is a case where you want to keep in mind and include in your conversation with your vet any travel history of the horse, your vaccination status, especially to the encephalitis and rabies. I don't recommend that neurologic horses are handled, even if they seem to be in precarious situations. They don't know where their limbs are, and so it's very possible for them to be dangerous. It's helpful if you can to video any neurologic horses, especially if they're intermittent, to help your veterinarian diagnose and create a treatment protocol. So first aid kits are important to keep because typically your veterinarian will be at least 30 minutes away if you're lucky. Up in Connecticut, sometimes I'm several hours away from my emergencies. Just so we had talked about, you want the tools to do your physical exam, a nice thermometer. I always recommend having a few thermometers, especially in a larger training facility. A stethoscope, I recommend trying a few stethoscopes, as some are easier to use than others. I also have clients include a flashlight in their first aid kit to look to better examine wounds, better to take pictures of things. They're great for looking at eyes, etc. I keep my bandage equipment quite simple and minimalistic, as I don't believe most horse owners need a lot. I like non-adherent gauze pads like Telfa pads to cover wounds until I get there. Some sort of rolled cotton to secure those bandages. Vet wrap, specifically for hoof bandages more likely, and a clean standing wrap. Hoof bandages are quite important. I truly enjoy using the poultice pads for almost all hoof cases. I prefer those to things like Epsom salt wraps or other over-the-counter salves, as those can harden the hoof, where most of the time I want to soften it. I also use duct tape in my hoof bandages for a little extra security and durability. I also recommend keeping gloves, not only for taking temperatures, but also should you have a contagious event in your farm to improve your biosecurity. The other things that often people have in their first aid kits are these common medications. Some of these are prescription medications, so like I said many times in this presentation, any sort of medication you should consult your veterinarian before using, but obviously any of these prescription medications need to be used under close supervision of veterinarians. Common NSAIDs we use are Banamine, Bute, and Equiox. It's important to know the correct dosing for these medications, which ones, slash none of them, that should be used together, and what circumstances they might be used best for. I also recommend most of my clients having some sort of gastroprotectants in cases of mild colic. I always have on my personal first aid kit omeprazole, a couple tubes of Gastrogard, and some sucralfate. Common ointments we use in wounds, even superficial wounds, would be silver sulfadiazine, triple antibiotic ointment, and then I also use the Today or Tomorrow syringes. Eye ointments that you might have on the farm are Neopoly back ointment. Some people will also have neopolydex or neopolyhydrochloride ointment. Those contain steroids, and it's very important not to use them unless advised by your veterinarian. They can make some eye injuries and conditions much worse than not used at all. The other thing that I wanted to touch on in this presentation is how to be prepared for emergencies that are inevitable. The first thing, being a veterinarian, that I emphasize is to have a good standing relationship with your veterinarian and make sure that your veterinarian provides emergency services. We've seen over the past several years diminishing equine veterinarians and definitely decreasing the amount of emergency coverage they provide. Out at Grand Prix, we have a definition of our full service clients that we provide emergency care for. And for us, that is requiring vaccines performed by and a physical exam performed in 1 calendar year. It's also important to know how to contact them in case of emergency. Most veterinarians have a separate phone number or extension for their emergency line. That typically breaks through any do not disturbs or focus settings on our phones. It's important to have a clean and safe area for your veterinarian to work in. Ideally, you want access to power should you need something like an X-ray machine or an ultrasound machine, as well as water in cases of lavaging, nasogastric tubing and colics, etc. And then the last thing I emphasize all of my clients to have is a trailer available to them or a friend with a trailer available to them for emergency transportation to referral centers, as not all emergencies can be cared for on farm. So to summarize, the main steps of an emergency situation for a horse is to have a good understanding of your horse's normal first and foremost. Make sure you know, or the people who care for your horse know their normal attitudes, what they normally eat, how often they go to the bathroom, etc. Establish a good relationship with veterinarians and other professionals sometimes that can help you construct your first aid kit and be available to you should something happen. Next is recognize an abnormal behavior in a horse. Like I said before, colic can be as simple as being a little bit inappetent, and if ignored, can develop into a much more serious situation. If it's safe to do so, do your basic physical exam, but it could also be as simple as taking your pictures or your videos, getting your respiratory rate, and removing your horse's food in cases of colic or choke. Then you'll call your veterinarian, give them all the wonderful information you've collected, and then follow their instructions there on out. Thank you to Dressage4Kids for having me. And there's my email below should you guys have any more specific questions that we can't answer this evening. Thank you.
Sorry, I had to unmute. We do have a couple of questions. I think one came fairly early on. What is a quadrant?
Oh, I'm so sorry. So in the horse, I actually don't know if it's other species as well, but in the horse, we divide the abdomen into 4 quadrants. So 4 sections, basically. And I'll use a little bit of equine or veterinary talk for a second. So this is the rib cage. Can you see my mouse? I'm never sure. Okay, perfect. So the rib cage actually extends all the way out to here in a horse. And so this is obviously the left side of the horse. So this is the left dorsal quadrant here. And this is the left ventral quadrant, dorsal meaning up and ventral meaning down or lower. And so you'll have your left dorsal, your left ventral, and then on the other side, you'll have the same. You'll have your right dorsal and your right ventral. And each of those quadrants should have 2 to 4, we call it borgami, but it's basically gurgling noises that you should hear as the intestines, namely the large colon, moves feed material and ingesta through through the system.
And another question, how often do you recommend taking the horse's vitals? I'm guessing they're saying with a healthy horse?
Yeah, that's great. I recommend taking a temperature if the horse is in a new environment, say you're showing or at a farm that does quite a bit of travel, I would recommend taking your horse's temperature at least a couple times a week up to daily. In new situations or horses in FEI tents, we actually take their temperatures twice a day, or leading up to scheduled hospitalizations, we take horses' temperatures twice a day. You can't really overdo it besides annoying your horse. But it's always good to have a normal. I would recommend taking it at least once a day for a week or two to kind of know where they stand. Obviously, if the ambient temperature is hotter, I typically bring them into the farm if they've been out all day for at least an hour prior to taking a quote unquote normal temperature. As far as heart rate and rest rate, I don't actually emphasize taking heart rate all too often just because of the difficulty of taking it. And same with respiration rate. But there's no harm in doing so.
Okay, and then we had a question about, oh, we have some more questions coming up. When a horse is suffering from choke or colic, do you offer him water?
So that's a great question. For colics, at least in my experience, I often don't. I do offer them water. I have water available to them. There's very little harm that water can do in the case of a colic, if the horse is willing to drink, which is honestly more of the problems they won't drink. In the case of a choke, I will have the water bucket there, as some horses will attempt to drink. So yes, I would say I offer them water in both scenarios.
What are some things that you don't usually think of that could be useful in an emergency?
Great question. You know what? Silly enough, I think a lot of people forget that they need a good working halter and good working lead rope. I've been to quite a few emergencies where I can't find a clean lead rope, and I can't find a halter that fits that specific horse. So that's quite important. I also have found many times where the lighting in farms isn't the best. So having a way to set up a bit of nicer lighting, especially in cases like a laceration or something that requires some detailed focused work. As far as your first aid kit goes and making sure you have everything you need, the other thing that I'd recommend that I don't have particularly on that list is a good probiotic bolus. Something like Full Bucket or one of those, or SureGuard Gold is something that I would use in a horse that I've had consistent dysbioses or gas colics in.
Speaking of colics, do you recommend any preventative methods for horses that have a tendency to colic with sudden weather changes? And boy, do we have a lot of those nowadays.
Oh yeah, yes. I think most colics that happen during sudden weather changes, in my experience, tend to be hydration related. Horses tend, either in sudden drops in temperature or even sudden increases in temperature, don't drink enough water. And when you don't have enough water to lubricate the gastrointestinal system, you can get things like impactions. So if I'm preparing for example, at least in Connecticut, a sudden weather drop or temperature drop, I will ensure that I have a heated bucket of some sort. A lot of horses don't drink cold water in the cold weather. I will wet their food if they will allow it. And I will include a second or third bucket of electrolyte or flavored water on top of the fresh water that's always available to them. You can also add a probiotic, but I don't know how much that actually does.
how much time off work do you give a horse after a choke or a colic? I would guess a not too serious colic.
Yeah, that's a great question. If they're mild colics and mild chokes that resolve and improve within, hopefully a choke resolves within a few hours, especially with intervention, and a colic most likely within, 12 hours. I typically give them at least 24 hours to recover from that event. Granted, everything else returns to normal. I won't lie, if there's a showing situation and they have a very mild colic the night before, as long as they're normal in the morning, I don't typically restrict their activity.
I think that's, let me double check. Yeah, I think that's all of our questions, Cleo.
Wonderful.
Thank you very, very much.
Thank you.
Greatly appreciated. And everyone that